Hello and welcome to Impact with Kenny Anderson. I'm Director of Multicultural Affairs for the City of Huntsville, and it's my pleasure to be able to share information and sometimes even inspiration about things that are happening in our great community. There's really a lot of stuff going on, and we try to cover as much of it as we can by sharing dialogue and information about a variety of topics that we think will be of some interest to you. Today will be no different, and we try to find topics that we think you'll really be interested in and things that we hook you on and get you engaged in. And we think we've got a topic like that today. I want to introduce my guest in the studio, and this is really going to be a very informative conversation. I'm sure I'm going to learn a lot too, and if I could take notes, I would, but we'll let those folk that are watching today make sure that they get a pencil and paper and take some really good notes, because we're going to be talking about the Affordable Care Act and the reality that is a part of America today. The fact that I think it was reported recently that about 3.3 million Americans have signed up for this plan or signed up for health care since the act was initiated. We got past that first hurdle of a few challenges in terms of access and some frustration related to that, and it seems like things may have gotten a little smoother now. So I've got two individuals here to talk to me today about this. First of all, Fred Coffey Jr. is an attorney with Sirote Permutt. I didn't say it right, did I? Sirote Permutt.
Permutt.
All right. See, I just talked about that, and look at what I did. But we're glad to have you on the show today to talk about this very important topic.
Thank you.
Also, we have Sonja Smith. She's a project coordinator with Enroll Alabama Project, and we're glad to have her here today also. Welcome to the broadcast.
Thank you.
Now, Fred, I want to start with you because I went to a healthcare forum recently, and both of you were there, by the way, sharing information for the community about this very important process of signing up for healthcare if you don't have it. The law now says that you need it. The law says that you can get access to it. And those are two issues that I think people have confronted for some time now. Can I get access, and do I really need it? Well, now it's here, and it's the law of the land. And there's a lot of questions, there's a lot of anxiety, and as I said earlier, there's been a lot of frustration. So hopefully we'll be able to give people some answers today that can help them with this process. But first of all, Fred, talk just a little bit about what people have to do as a result of the law, because there's still a lot of people asking questions with regards to, is this something that applies to me? Is this something that I need to take advantage of? Is this something that I have to do? Are there penalties associated with this? Talk a little bit about what people have to do as it relates to this law.
Kenny, actually there are probably two areas or two groups that are impacted most. One would be individuals, and the individuals required, most individuals are required to have health insurance. The other group are employers. Now, I would tell you that employers that are smaller than 50 employees, the Affordable Care Act doesn't have any impact on, because they're exempted from the requirements. But for employers that have more than 50 employees, then there are requirements. And initially those requirements kicked in January 1, 2014, just as the same time that the individual mandate kicked in January 2014. But as you know, for the employers, it was delayed until 2015. And so employers have the entire year of 2014 to cope with the issues, get questions answered, and to make decisions. Well, just recently, in fact, just this past week, for certain employers, those between 50 and 100, it was delayed even farther to 2016. And so there continues to be delay for the employers to have to provide, or at least offer, not provide, but offer health insurance to their employees. So if you look at an employer, and if they're 50 or more, then they have a decision to make. Because if the employer doesn't provide both access to health insurance, and it indeed is affordable, because it can't consume all of the employees' disposable income, it has to be affordable. And if they don't provide that, then they'll have to pay a penalty. Well, that's the employer side, and so there are a lot of decisions being made. Do I have 50 employees? And in order to make that determination, you add up all the full-time employees, all the part-time employees, divide by what would be a full-time employee, and see if you have 50 people. If you do, then the Affordable Care Act applies. Then you're mandated to offer to everyone that works 30 hours or more a week health care insurance. Well, that's for the employer. The individual, beginning in January 1, 2014, most individuals have to have health insurance. Well, many individuals already have health insurance. Their employer provides it, or it's provided by the VA, it's provided by Medicare, or by Medicaid. And so many individuals already are complying with the Affordable Care Act. But for that group of people that did not have health insurance prior to, they, by and large, are now mandated to have health insurance. Well, where do you go to get that health insurance? You go to the healthcare exchange. It's not the only place. You can buy it in the private market. But through the healthcare exchange, certain individuals can get premium subsidies or tax credits. One thing to remember, they can only achieve those tax subsidies and tax credits during the open enrollment period, which is coming to an end in March. And so although you can get health insurance after March, you won't be able to get the premium subsidy or the tax credit until the next open enrollment period in October. So by and large, it's individuals and employers that have something to do under the Affordable Care Act.
Has healthcare now really become affordable? Because for a lot of years, many years, people have, of course, seen healthcare benefits as something that they have to have in order to be able to move forward through life. They had families or medical issues that they had to be able to manage. And one of the big concerns was just the high cost of that. You go in for hospitalization or some type of medical procedure and you end up getting a bill and you think, oh, that's not so bad, I'll take care of that. Medical insurance takes care of a portion of that, and I've got my small deductible or whatever that might be. And then another bill comes from another agency and another service that I got, another service. You got 5 or 6, 8, 10 bills coming, and you're thinking, boy, this is really piling up. So you had people really feeling that even though they had health insurance, that they had some real benefit and value. And of course, I feel that way, but I also felt a pinch at times as well. With this new act that's now out there for everybody to take advantage of, all of these uninsured people that are out there, is this making health care affordable for them?
Kenny, it depends. And that I'll go back to the premium subsidies and the tax credits. If you go to healthcare.gov, which is the exchange for the state of Alabama, as you probably know, the state of Alabama elected not to have a state-based exchange. And so our exchange in Alabama is the federal exchange. So if you go to the federal exchange for a 35-year-old male living in Madison County, Alabama, and you select the least inclusive plan, the plans are bronze, silver, gold, and platinum. So the least inclusive would cover 60% of your health care cost. That particular plan for a 35-year-old living in Madison County is about $204 a month is the premium, if you paid the full premium. It also has a $6,350 deductible on an annual basis. And so you're out of pocket $6,000 for most individuals. That's going to be a surprise for most individuals.
And significant.
And significant. And so the possibility of getting a premium subsidy or a tax credit through the exchange is the reason to go to the exchange. And many people will qualify based on age, based on family income, et cetera. And so in the absence of those benefits through the healthcare exchange, you'd have to pay the full premium cost. And for many people, that still will not be affordable.
And I think you're right. A lot of people will be surprised by that because people automatically think that now that I have a policy, I'm covered, I'm going to be okay, but they're not really seeing that dimension of the whole process, which could be pretty shocking for some people.
Well, most employee plans provided through the employer, deductibles for a surgery that comes to mind may be as low as $350. A deductible for someone on one of the plans that we've been discussing could be not the deductible, but the out-of-pocket could be as much as $10,000, and the individual would pay the first $6,000 of that. Most people don't put $6,000 away on an annual basis to contribute to their health care cost,
And I think that's part of the key of what you're saying too. This is an annual fee.
an annual deductible.
So, wow, that's significant. Sonja, I'm going to bring you here in just a second, but I got to ask one more question because this is the piece that I think, for lack of a better word, concerns me about the state of Alabama. And that's the fact that the options that are available are not as broad as other states may be. And we know that, would I be wrong by defining or describing Blue Cross Blue Shield as a behemoth in this state in terms of its share of the market as it relates to health care?
Blue Cross Blue Shield provides services to approximately 88% of the citizens of the state of Alabama.
88%.
88%. Blue Cross Blue Shield is the only health care insurance company that's offering health insurance policies to all 67 counties. There are a few other insurance carriers in the more populated areas, but they are the only one in all 67 counties. And so there are fewer choices in the state of Alabama. That's absolutely correct.
Does that work for the consumer or does that work against the consumer? Does it just depend?
Well, it really, again, depends on what the consumer's opportunities are. You may have read some of the news pieces of people that actually, for the most part, said they didn't like the Affordable Care Act and all the requirements. But when they went out to the healthcare exchange, they discovered, based on their family's income and so forth, that they could get subsidies for their premiums and they could get tax credits such that their cost really was diminished, and now they have health insurance. Now they have health insurance that will pay for those inevitable reasons that we all go to the doctor and the hospital.
Yeah. In your personal opinion, last question for the moment, in your personal opinion, is this a good act for this country?
My personal opinion is that there are many portions of this act that are very good. No longer do we have pre-existing conditions as a reason not to be afforded health insurance. No longer can you be dropped when you get a devastating diagnosis. The preventive health care requirements under the Affordable Care Act for women, children, and adolescents, all those have to be provided in an essential health benefit plan, and none of that cost can be passed through to the consumer. And so there are many, many aspects of this that are superb in my judgment.
Yeah. Sonja, you of course have the opportunity to work with this up close and personal as it relates to people actually signing up. Mm-hmm. And as I started this broadcast today, I talked about the many problems people had early on in trying to access the site. There were a lot of people saying this is, we told you so, this is a bad process because the technology isn't working, which I thought was just a kind of a flawed argument anyway. But regardless of that, it's up and running now. People are registering. I even have some friends that have said, I've registered, I have insurance now, I'm feeling good, moving forward. What are your early experiences telling you about people who are reaching out for this insurance? And are they having more positive experiences than negative experiences? And what kind of feedback are you getting in the early process?
Okay. Well, like you said, in the very beginning, things were a bit rocky, but since the website has been working more consistently, we've seen a lot of progress. In the state of Alabama, we have over 43,000 individuals that have enrolled in a policy through the marketplace, which is great. So that shows a lot. That says a lot for our state and the need for something like this, and then just the citizens really wanting to be supportive. So far we've seen a lot of great positive stories. A lot of people that maybe never had insurance now are able to do so. And with the support of the financial assistance that's offered, then now it is affordable for them. We constantly are getting phone calls or letters from consumers we've helped thanking us for our assistance.
Do you have a sense of, you've registered 43,000, do you have a sense of how many eligible people in the state there are, or a rough estimate of how many people there might be who are eligible?
I believe it's 130,000?
Something like
that, 130, 140,000 if I'm not mistaken.
And I just read an article last week, I believe it was USA Today, if not it was Huffington Post, but it was one of those periodicals that said that Alabama has one of the fastest rates of sign-ons for the Health Care Act in the nation.
Yes, we're doing great.
Yeah.
We're doing really well.
So do you think that this is, and when I say this, I'm talking about not just the mechanics, but the whole idea of understanding some of the things that, as Fred said, some of the value in this act and some of the benefits that come with signing on to this process because of some of the changes in the law as it relates to access to care and some of the dynamics of dealing with healthcare issues, that we as a state perhaps will have something to demonstrate to the nation as it relates to people who have embraced this? And does it perhaps also say something about the idea that from an economic perspective, we have major challenges in this country, in this nation, in this state, but we also have major challenges as it relates to health issues in the state. You know, we always see our name up there as a state when it comes to high rates of diabetes and obesity and heart disease. So it would seem like we'd have a ready population of people who could certainly benefit from many of the things that could be afforded to them through this process by signing up for health care.
Yes, I think definitely, to answer the first part of your question, yeah, we can definitely be an example to other states, and a positive example. And I think that, you mentioned about how we only have 2 providers right now. I think it's really good that we've had so many people to get enrolled, because I think that exposure will then encourage other insurance carriers to come on board and say, hey, there's money to be made in Alabama. And so I'm hoping that next year we'll have more providers that are being offered. But I don't think it's a bad thing that we just have the 2. I think if anything, it streamlines the system so that people aren't overwhelmed. I talk to people in other states that might have 100 and something plans to choose from. So 100 and something plans versus the 10 that we have, it's a lot easier to sift through 10 plans than 100 and something. So I think, despite what we have, what seems like we don't have, I think it's actually a good thing for us.
Well, I mean, you make a great point, because if I had 10 plans to choose from, it would probably take me about 3 months to figure out which one I wanted to use. I got to evaluate everything and just compare stuff and all that. Yeah, I'm still saying, is this the best thing? And so, I mean, you make a good point as far as that's concerned. So I want to register for health care, and I'm thinking about this process, and I'm hearing about all of this stuff that's happening right now. Where does a person begin?
Okay. Well, there are several ways that a person can enroll. You can either go online to healthcare.gov, and you can go through the application on your own. You can call into the call center. It's a 1-800 number that's open 24 hours. That number is 1-800-318-2596. A person can fill out a paper application, which would take a little bit longer. So just want to keep that in mind. And as we're coming to the end of open enrollment, that might be a bit tricky to get in before the deadline. Or they can meet with a navigator, and that's what Enroll Alabama is. We are a group of navigators, and our goal is to, 1, educate the community on the Affordable Care Act, and secondly, to help people get enrolled. And so they can call here in the Huntsville area at 205-332-0175. Or if you have family members around the state, then you call our main office in Birmingham, and we can connect you with the appropriate office. And that number is 205-918-8192. And so we can schedule an appointment to meet with people, either at, they can come to our office, or we can meet them where they would feel comfortable. Or we have also remote signups happening around the city, which we're really happy about. So local libraries, Drake State will be set up there regularly where people can go and get assistance with the application.
So there's a wide variety of opportunity for people to sign up. I know I went to the shower center the other day, and there was a couple of people sitting in the lobby, and I was going to an event. They said, "Excuse me, sir, do you have health care?"
Yeah.
And so I went over and talked to them, and they said, "Well, we'll be here tomorrow. If you know people, please send them." And so it's good to see that proactive thing is happening where people have access in various ways. What's the time turnaround between, and I'm just estimating, as a person that, values my time and feels like I never have enough time to do everything I need to do anyway, and tend to get discouraged if something takes too long. But let's say, for instance, I woke up this morning and I'm not signed up for healthcare yet, and I want to get signed up. Is it an hour process? Is it a day process? Is it a multiple day process? What kind of a process is it on the average?
On average, the process takes about 45 minutes.
Less than an hour.
Yes.
Okay, I
On
can handle
average,
that.
45 minutes. So some people can get through a little bit quicker, and some people might take a little bit longer. It really depends on your personal situation, the number of people that maybe are on the policy,
Okay, yeah.
or in your household rather. And according to the marketplace, a household is by who you claim on your taxes, not who's under your roof.
So that could have an impact on choices, certainly, but certainly on
Right,
premiums.
definitely on the tax credits that you would be offered. And then also, if you maybe had an email account, so if you're going online and you're doing the application through healthcare.gov, you will need to have an email account. So if you don't, then that would take a little bit longer to get that set up.
I got you.
So, there are factors that are included, calculating income, breaking that information down. But for the most part, we can get people, we say at least at the most an hour.
Right, right. That's reasonable.
Well,
when you think about
and
it.
maybe to follow up with a question, signing up, paying, utilizing, that I think would be interesting to people as well. 'Cause
Right.
just to sign up doesn't mean you can go to the hospital that afternoon.
The first step.
That's very true.
right.
That's very true. So, like Fred said, we are in the middle of open enrollment, which goes through March 31st. So at this point, if a consumer were to enroll before March 15th, then their coverage will start on April 1st. So between now and March 15th, April 1st. If someone waits until after March 15th, so between March 16th and the 31st, then their coverage will start on May 1st.
Okay.
So there are little deadlines in between that. After we hit the end of open enrollment, which is March 31st, then like Fred said earlier, the next open enrollment won't start until November the 15th. And that's when anyone can go back and they can enroll or change the policy that they might have chosen the first time.
What happens to those people who miss the deadline?
Right,
March
so-
31st comes and goes. What happens to those people?
They can still get
Right.
insurance. They just can't get the premium subsidies
Okay,
because
so that's the incentive,
that is the
to
incentive.
do it early enough to get the premium subsidies.
When there are special situations,
There are.
qualifying life-changing experiences that will
Okay.
allow you to go in the marketplace and so say someone were to adopt a child or have a baby, then that's going to change your household size. So you would need to go through the marketplace again when that happened. If someone were to
That's not
lose a
something
job,
that's not something you would necessarily have to anticipate. It's just you would file a claim of some type and.
you would
It
no, you'd
allows you
actually
to
go
register outside the open enrollment.
right.
time.
Right, okay.
Right. So say in August, we're in between open enrollment periods, and you have a baby in August. So your household has changed, and
Sure.
so that means that the tax credits that you would have been offered would change.
Right.
So then you can go onto the marketplace then, and you could amend your application.
Okay.
Or say maybe your income, you had a significant change in your income.
Loss of job?
Loss of job, gain of a job,
Okay.
then you would report that to the marketplace and you could make those changes then.
So this is also a process where you don't just necessarily do it once. It's something that you kind of have to monitor.
You do.
Sort of. I mean, obviously some people have less intensive need to monitor than others, but it's not something that people should just do once and say, okay, I've done it, and then life goes on. They have to be kind of in tune with what's going on and responsive to those things.
Well, one of the realities of the Affordable Care Act is it's evolving. The regulations are evolving, the deadlines are evolving,
Yeah.
the rules are changing. And so you need to constantly sort of check back to be sure that a rule hasn't changed that would benefit you.
Yeah.
One of the things I didn't mention before is in the state of Alabama, in addition to not electing to have a state-based exchange, our state has also not chosen to expand the Medicaid program, which is significant in Alabama. That would have added, Sonja probably knows the number exactly, that would have added many, many other people with health insurance that aren't being added because we didn't expand that program. Those individuals are exempted from complying with the Affordable Care Act because the state of Alabama chose not to do that.
Right.
And that could change in the future as well. There could be an opportunity in the future for that expansion to take place and those individuals to be able to be covered.
Sure.
The other issue are the penalties. You know, if you don't comply with the Affordable Care Act as an individual in the first year, for an adult, the penalty is $95. And then it continues up over the next 3 years to about $625. Different for children, and there is also a limitation of 1% of the household income. But that's a penalty. No one comes knocking on your door to collect it. But if you're due to get a tax refund, it'll be deducted from any refund that you would otherwise be due. And so when we all report our taxes next time, there are going to be new questions on our tax returns having to do with health care. And once we answer those, then there'll be calculations made, and that's how the penalties will be assessed.
Yeah.
Right. Yeah, that $95 or 1% of your income per person in the household.
Okay,
so
it's per person.
Right, per person in the household. So it's not like you get to choose
Right.
either $95 or the 1%, whichever is greater,
Okay.
is the one that you would have to pay.
Okay, okay. So there, as you said, Fred, I think this is an evolving process and one that we're going to have to watch at multiple levels and see exactly what will happen as time goes on. We don't have all the answers today, obviously.
Well, and there continues to be political challenges
Yeah.
to the full implementation.
Yeah.
And you asked me before if I thought the Affordable Care Act had good parts. It does. It also has parts that need to be modified, and they will over time. And a lot has to do with the evolution of the process. You know, when Medicare came about, it didn't start without any bumps in the road.
Sure.
And so we'll look back someday to the implementation of the Affordable Care Act, and you know, we'll remember all the problems. We'll sure remember the website problems. Nobody envisioned that. You know, had that not happened, we'd all feel a lot different about the Affordable Care Act today.
Yeah. Well, you know, you're absolutely right about that. And I think we all tend to play armchair quarterback to decisions that are made in life by people in key positions that have those responsibilities. And I think you're absolutely right. This obviously is one of the most significant pieces of legislation that's come about in my lifetime, and perhaps several generations before me. One of the most, if you looked at maybe the top 5 to 10, this is one of those. And certainly will have a profound impact on the way, not just how business is done in the medical field, but also how we live our lives. The many things that are now a part of our lives as a consequence of this, and choices that have to be made, and other privileges that come with that as well. I have to say that one of the most exciting things to me, and I did applaud early, and I'll applaud again, was that pre-existing condition. I always thought that was one of the most unfair things about life. That, you know, and of course I'm the consumer. Maybe if I was a different perspective, I'd think about it differently, but I'm thinking, you know, really, you know, I didn't ask for this thing to happen. It happened, and I hope I can get treated for it. I've been paying medical insurance for years, and you're saying that because it was there, I can't, you know, so I've just always had an issue with that, and so I'm really happy to see that that's been addressed in this process. And I'm also happy to hear what you're saying, Fred, about just the whole dynamic of there is good and bad in the process. It's something that we don't throw the baby out with the bathwater, as people used to say. We don't just take a bad thing, pick at it, and say the whole thing is horrible, in the same way that I guess if some of us had the privilege to be around when Social Security was started, we would have had some of those same arguments and disagreements. But in the long run, I think we'll see some really, really beneficial things that will come as a result of that. So thank you for sharing the information that you shared today. I think we need to give people that are listening some telephone numbers and contact numbers one more time. I know there's a great website that they need to access.
Yes, definitely.
Some people have probably already done that, but there's some that are still dragging their feet.
Yes.
Because they're procrastinating.
That's okay.
And they're not realizing that March the 31st is right around the corner, or March 15th, actually. They can get it early if they get before March 15th. So give them that contact information one more time.
Yeah, so they can go online to healthcare.gov, and they can enroll on their own. They could call the call center, and they can enroll over the phone at 1-800-318-2596. If they prefer to use a paper application, they could call the call center and someone would mail them a paper application, or they can meet with a navigator. The local number here is 205-332-0175, or they can call our main office in Birmingham at 205-918-8199. 92. And so they could do that. We also have enrollments that are taking place all over the city. A couple that come to mind at Drake State on February 24th and 26th. We'll be at Drake State, and then throughout the month of March we'll be at Drake State on Tuesdays and Thursdays from 5 p.m. to 7 p.m. So people can come and drop by, and if they have questions or they want assistance with getting enrolled, that they could do that.
And even though the show may air after that, which is perfectly okay, the thing we want people to know is that there's still opportunities to get connected in ways, and that there are things happening all over your community. Pay attention. When there are health forums that take place, go out and get the information. Don't just ignore these things, because it's always valuable stuff that's going on. Sonja Smith, Project Coordinator with Enroll Alabama Project, thank you for being here today.
Thank you.
Fred, I'm going to give it one more shot. Sirote and Permutt.
Sirote and Permutt.
Permutt.
You were close.
Trying, man, I'm struggling. I'm going to get it sooner or later.
Like permanent. Yeah.
Permutt. So if I had just practiced, I would have done better, because practice makes perfect. Practice getting on that site, and make sure that you get signed up. I want to thank my guests for being here with me today. They've provided some very valuable information that I think you'll be able to use. And share this information with a friend or loved one or colleague, because I'm sure that they'll be able to do something with it as well. As always, for Impact, I'm Kenny Anderson, and I'm glad to be here with you. We'll see you again on our next broadcast. Have a good day.